Bienvenidas, bienvenidos. Muchas gracias por acompañarnos en este episodio de People Power Health Insights. El día de hoy tenemos a un gran invitado, el doctor Shapiro. Doctor, ¿cómo estás?
Un placer estar realmente con ustedes y la verdad muy emocionado de la plática del día de hoy.
Okay, well, now that we introduce our guest in Spanish, we will switch back to English for all of our English-speaking followers. And the first question, Dr. Shapiro, that we always ask our guests is, if you walk into a room full of people that you have never met, how would you introduce yourself?
That's a beautiful question. I will start with where I was born, and it will sound like this. Born and raised in Mexico City, from a migrant community, a migrant family, saw the differences of life in Mexico from, like the little pueblitos, the little towns to the big cities, and encouraged me to try to figure out how to make a difference. One of the connections that I always try to share is that the enjoyment of nature, the enjoyment of family, and the connection with the culture has been always an aspect that I love doing. Then I will introduce myself, where I'm from, what I love, and a little bit of the life experiences that I have had.
Amazing, thank you. So, well, let's start with that because you were born and raised in Mexico City.
Correct.
And you are currently living and working in the US, in the state of California. Is that right?
Correct, Dr. Gonzalez.
So yeah, please let me know, how did that life journey took you from Mexico City all the way to the US?
It was an amazing, amazing, amazing path. Born and raised in Mexico City, a small city of more than 24 million people. And I did all my high school there. I started actually medicine there. And during that process, I was very involved with Boy Scouts and also with
Wow.
the Red Cross and a lot of, volunteer or gearing up for the community. And that was kind of education, also disaster training and mitigation. Love doing that type of things and going out there when we had hurricanes, natural disasters, and I was very involved with that part. Early on, Dr. Gonzalez, I had that talk with my parents, and it was one of those talks that you're 16, you kind of know where you're going, but truly you do not measure the power actually of your words. And I
Yeah.
told them, and I'm going to say it first in Spanish. I told them,
Yeah.
voy a ser médico de políticas de salud pública internacional. And when you translate that to English, it sounds, I'm going to be an international policy physician on the international realm. There's really no good translation between public health and public politics in
Yeah.
Spanish. Then
Yeah.
they only heard that their future doctor was going to become a politician. And clearly, that was not my objective. And they were like, well, we respect you. I hope that you do well, do you? But, please make sure that you continue serving the community. Then early on in my career, I was very involved with binational work. I had the opportunity to be the liaison between Mexico and the World Health Organization, and I loved it. And I got to combine that part, Dr. Gonzalez, that excited me, and put that words of being on the public health on the international arena in a bigger scheme. And I got to see the little pueblitos, little villages in Mexico, and also what was happening in Switzerland and with other countries. The importance of combining the power of all of us, because in reality, every country wants health. Every country
Yeah.
wants to make sure that we are advancing, that they are taking account of their communities, their underrepresented, people that are the majority of all of us, that sometimes we feel disengaged. That actually bridged me to continue my dream of becoming a pediatrician. I did my training at Mount Sinai Hospital in Chicago, loved it, and I saw something quite interesting. You get to Chicago and you hear about the wind, snow, and it was the first time that I was actually seeing snow. My
Wow.
concept of snow before in Mexico was the one that comes with flavors and colors. And the first thing
Ice
that they
cream.
told me, yeah, exactly, the one that you put in your mouth. And the first thing that they told me is like, never, never, never put any snow from here in your mouth, especially the one that has colors or smells different. Then I
Oh.
got it quickly. And also, I started to understand the binationality of US and Mexico relationships. I was actually working very near La Villita. La
Mhm.
Villita is one of these magical places in Chicago where everything is in Spanish. It has a huge Mexican population living there. You get the tortillas, you get the tacos, you get absolutely everything there with the chilling effect of -20 in winter.
Wow.
Well, it's actually less than that, but you get that part of serving. Then I got to envision live with the community for 3 years there. Ended up in Fort Myers, Florida, working in a federal qualified health center that mainly catered migrant workers, different backgrounds, people from Haiti, Central America, Mexico, and other places of the world. And it was just mind blowing. And during the entire process, started to start thinking of how can we create better services and better quality, and of course education and component of transmitting information to our community.
Mhm.
And there's two components. There's the communication part of it and the policy part of it. The communication part of it, and I don't know if you have had the opportunity, Dr. Gonzalez, but sometimes, and for everybody that is actually seeing us and hearing us, sometimes we are want to do something, and because we are afraid of taking a decision, we're just petrified and we just don't do anything. We saw it in COVID-19 where we had a lot of the community members that didn't have enough information to say yes or no to many things. Then I started envisioning that part, and in 2009 I had my first pandemic. It was the influenza H1N1 pandemic.
Yeah,
And
yeah.
we saw the same errors that we did in COVID-19, where the community was completely afraid of many medical stuff, was afraid of the information, and we were all confused. Then my mission has been to make sure that at least the community has enough information, because it's not that they are uneducated, it's not that
Yeah.
they don't want to learn, it's they have 2 or 3 jobs. They need to make sure that they're balancing their kids, school, work, and absolutely everything regarding the family. Unless we create a way to communicate directly with them in a quick matter that they can actually decide, will completely be petrified with any medical decision that we have for the future of us. Then I started understanding the important part of having doctors, nurses, providers actually out there and talking. If not, we leave a void, and we know when we leave that void, it creates misinformation,
Yeah,
disinformation, and it creates a lot of headaches. And
exactly.
finally, I ended up in Los Angeles working with an amazing federal qualified health center called AltaMed. We
Okay.
currently serve around 500,000 patients. We cover probably 120,000 are kids, and we cover from obstetrics, internal medicine, pediatrics, family practice, mental health, dentistry, and other specialties to make sure that our community is taken care of.
That's an amazing journey. And so, how long have you been living in Los Angeles?
Since 2016, then to date,
Okay.
it will be around 8 years.
Wow, 8 years. So, I mean, and now, if I may, I will start bridging with some of the work that you do, because for all of our followers, Dr. Shapiro is not only a physician, but he is also a person that uses social media to share information. And he does this in an amazing way. I mean, I've been following him on Instagram for the last few months. And are there other like social media accounts that you use?
TikTok, I do funny videos over there. Also X, and I tried also to publish the same thing in threads. And for more geared to professionals and other policy making community, LinkedIn. That's the other one
Perfect.
that.
Amazing. So and most of this work, I may say, is focused on the Latino community and on immigrant families and the health needs that they have. So my question here is, how did that desire of like moving in that direction started? Because we know, I mean, we both know like physicians that work in the US, but that they are like they were very specific in some topics. So I don't know, they work with neurology, they work with cardiology, they work with like oncologists. So they have a very specific, but they don't work a lot with like immigrant health or with the Latino community. So when did that moment started for you to say, I want to work in this direction?
There were two different things that were happening at the same time. One is what happened during the pandemic in 2009 with the H1N1 influenza pandemic. And the other one, the reality of the Mexico-US relationship. The first part on the communication part was probably has happened to a lot of us, that there's like weeks that you end up saying the same thing because that's a trending topic, or there's some news, or like some weird thing happened and everybody's actually talking about something. Then you end up repeating yourself a lot of times. Then with H1N1, the same thing as COVID-19 and the same thing that happened with Mpox, we needed to do a lot of education with the patients. But if I really wanted to reach the 200,000 kids that I needed to reach and the families, my wife will divorce me. I will never go back to my house because I needed to actually work and see probably like 3,000. I did the math. It would take me like 150 years to actually, with 30 patients a day, in 7 days a week, it would not, the math doesn't work out for that. Then
Okay.
I needed to figure out a way to create that space. And I started actually writing to different media stations. And on like, I don't want to be on camera. Let me, at least these are the topics and the talking points that you need, because there was no Google Translate. There was no way to do a lot of the things that we're doing currently. Then the information was not being translated to Spanish. And of course, it was very delayed with English. Then, you know, the community was completely naked. No information, misinformation bubbling up, void of feelings. Then I found that, you know, having a 3-minute episode of talking about vaccines, talking about how to make sure that your mental health is okay as a father, as a mother, then that actually at least prompted conversations. I had a 3-minute where a lot of people will gear to that topic, and it was way more efficient to do mass communication. And of course, continuing the part of the clinic, because that's my anchor. That's where I get all my superpowers, and I am extremely grateful for the families that I take care of. On the other side is the part of the binational part of Mexico. And the same thing, you can actually add that Colombia, Dominican Republic, where a huge percentage of Mexicans live here. Then there's a real connection there. And let me give you a couple of numbers that is quite interesting. And I'm going to start with Libya first. And maybe you will know, maybe you won't. But are you ready?
Let's see. Yes.
What are the 5 largest, most populated cities that are actually most populated Mexican cities in the world?
In the world? Well, obviously Mexico City should be one of them.
Yes.
If I think inside of Mexico, I would say that Monterrey, Guadalajara.
Yes.
But if I think outside of Mexico, I'm sure Los Angeles.
Yes.
Has a huge population of Mexican citizens.
And I'm going to serve you the last one, Chicago.
Chicago, got it.
Then from the 5 most important, most populated Mexican cities, 2 of them are in the US.
Yeah.
And that actually reflects the reality of where we are and the importance of health that doesn't have borders. And what do I mean with this? From the 65 million Hispanos plus minus that we're here, let's say that 50% are Mexican. That means, or Mexican American, that means that 30 million are there. Then imagine that we play with the numbers and we say like 10 million, 50 million. In Mexico, total Mexicans in the world, it's 124 million people. Then you're talking about like at least 10% of the Mexican population is living here.
Yes.
And I'm not talking about remesas, you know, like actually money that is transacted. I'm not talking about, I'm not talking about, but just with having 10% of the population living here, it's an important number. And it's, you know, 5, 7, 8, 9% of actually the population here in the US. Then there's a connection there. And health is the best way to connect communities, to connect and create impact, and to talk with families. Then having the communication part of it and creating policies and uniting them to bring services, education, pipelines, workforce development, and of course, creating that civic engagement with our community to be represented are all of the, the entire package of the things that I love doing.
Yeah, that's amazing, and I absolutely agree with you. Those numbers are difficult to grasp. Are impressive. Okay, but well, again, we have those numbers, and they are real. But why does Dr. Shapiro decided to head in that direction? Like, I mean, I'm sure you have like some other spaces where you could work. So, were there any moments, any decision, any event in your life that took you like, it's here, it's in this arena?
There were a couple, and then you're right. A lot of the times when you start, like, you see the end product, but there were a lot of, and we say in Mexican Spanish, madrazos, a lot of hits that I took.
Yeah.
Then I have a lot of, I call it my war scars that have been processed during the past almost 2 decades. Part of the process is figuring out what I really wanted,
Okay.
and I really wanted to be joyful and give back. Thanks to actually Mexico, my family they were actually migrants to Mexico, and they opened the borders for them, and they were welcome, and thanks to them I'm here. Then I really wanted to give back and be part of that process of giving back. Then as
Okay.
a Mexican, I really want to, if I'm on a privileged position, I want to invite more people to actually make the difference. Then
Yeah.
I had the choice and opportunity to stay in Mexico, and I love it, and I still do. I held a couple of positions in Mexico as with the Ventanillas de Salud, with the Mexican Secretary of Health, Foreign Affairs. But I really wanted to help people that were living the same process that my family lived when they came to Mexico. And where to do that? Well, perfectly acquainted to the US. Then I have been working all the time in federal qualified health centers in underrepresented communities. And that means Hispanos, that means African Americans, that means migrant kids. And that actually opens a lot of things because as a pediatrician, one of the things that I love the most is that if we actually can create a better world for our kids, starts when they are young. When we are old, like you and me, my friend, we already have done a lot of crazy stuff. The liver will remember a lot of things, our lungs, and there's a lot of scarring there. But when we
Yeah.
actually have our kids in front of us, there's a possibility of creating a better future. And that
Yeah.
could be, like it's not a free food, right? No, but making sure that they, if they have adverse childhood events, to make sure that we're trying to mitigate them. If they're having asthma, making sure that we're checking the air they're breathing, the medications that they need, the community around them, and of course, like, do they have AC? Do they have all, trying to go above and beyond the things that we have. As physicians, we can control 20% of the health of our patients inside our clinics, hospitals, and everything else. But moving to that 80%, it's
Yeah.
extremely important. Those social drivers of health are
Yes.
crucial for the things that we do.
Exactly. No, no, 100%. Now that we're talking about these social drivers and these social determinants of health, I would like to ask you, are there any particular examples or policies that you have seen throughout the years that working on them and shifting them will make a huge difference in the immigrant families and in their health?
I love the question. And I'm actually, in Spanish, we say gallina. You're actually making my
Good
goosebumps all
bumps.
over. And let me tell you why. There's two. It's civic health,
Mhm.
and the other one is workforce. And I'm going to start with the, I call it the easy one, but it's workforce.
Okay.
The moment and we know that when we have friends and they speak our own language and they understand our past and they were high school buddies, they know our families, we can hear their words, and sometimes we actually follow whatever they are telling us to do.
Mhm.
The same thing happens with physicians and our patients. Then making sure that we're creating that pipeline of diverse physicians that understand the language and the culture can make a huge difference. right now, and I'm from California, and the same thing holds for Florida, Tennessee, Illinois, like name it. At the moment that we have community clinics, they are served with someone that actually understands the language and the culture. It makes a huge difference because we're understanding what's happening with the tecitos, with the teas, with the herbs, with certain procedures that are culturally different for each of us, and we can connect. Then that applies to diabetes, mental health, vaccines, preventive measures, prostate cancer, screening. There's a lot of data out there that when you pair them up, it makes a huge difference. And one of the, and it's quite impressive. There was an article probably around 12 to 16 months ago where the best thing that determines survivability of a NICU baby was ready.
Yeah.
If the patient was actually African American, comparing it, the same medications, same treatment, same everything, the differential thing about survivability and actually having a better outcome was having an African American doctor.
Wow.
Point blank. Same thing we have seen with Hispanos, with diabetes range, with making sure that the glucose is not all over. Then trying to bring that part from high school, creating that pipeline from mentorship, creating that pipeline where, going to med school, it's not, like donating a kidney and selling it out, making sure that we are also creating those residency spots and creating that pipeline and including also international medical graduates on the mix. Then we need to be seeing that part of workforce as one of the components here. And the other part for sure is civic engagement. And it's one of the things that a couple of years back they invited me, like, doctor, would you like to talk about getting registered to vote in your clinics? Like, hell no. Why? I'm a doctor. I don't do that. I can do diabetes, I can do depression, anxiety, ADD, ADHD, vaccine, whatever. Why should I talk about that? Well, I was wrong. I was completely wrong saying that. Because when I started actually getting involved with this, we talk about most of the other things that we have. Then one of the most important things that I saw, and one of the interesting part that I was seeing is that I, as a physician, talk about dead and dying, the best times of their lives. I talk about if they own a gun or not and how to secure that. I talk about if they're feeling that they want to hurt themselves or others. I do very sensitive questions, and I was afraid to ask if they are registered to vote. It was mind-blowing. It was like, there's something here. And why is this important? We were talking about a couple minutes back about as physicians, we feel frustrated. We tell our patients, go out there, eat well, do your exercise, do your things. But in reality, at the moment that they leave our clinics, they open the door and there's hunger. Yeah. Maybe those green spaces that Dr. Shapiro was recommending do not exist, or they're simply not safe. The air that they're breathing around industry, whatever, it actually includes and increases the possibility of having asthma, emphysema, and other things. Then we have all these things that me as a physician cannot control at all. Then unless I started that conversation of, are you registered? Are you civically engaged? How's your civic health? Would not make a huge difference, and I will still stay on my 20% without actually achieving that 80% that can be touched by representation. Then between civic engagement and making sure that we have the workforce, the physicians that we need, that's a combination that our community can actually take advantage of, because that way we'll have the not just access to healthcare, but someone actually that will be there to hear us and move us forward. And exactly. Also on the other side, making sure that the resources, the streets, the local things are extremely important that sometimes we don't think about. We think about the big thing, the federal thing, the who is going to be the president, but most of the things that we have are local. Then unless we're there, we don't count.
That's completely right. We are getting into the last part of our conversation, Dr. Shapiro. So I just wanted to ask you first, is there any final message that you would like to share with our viewers? Mostly it's clinicians from all across the world that are interested into health advocacy and are looking to like listen to like the voices of people that have been enrolling and participating. Do you have any message for them?
Give me 1 second, let me connect the computer. Dame un segundo. ¡Se acabó la batería!
Okay. Perfect.
Sorry, estaba viendo. Por eso yo creo que me está dando el error del sonido, se estaba yendo
Del sonido. No worry.
Okay, ya estoy. The message is clear. If we really want to be a physician, if we really want to change the health of our community, our patients, we need to get involved with all aspects of it. It's not that 20% that we can control in the clinic, in the hospital. We need to move to touch those 80% that are driven by social determinants of health. No matter where you are, it's consistent that all of us want health. We need it. We need to be ready to move, to work, to study. Unless we create the environment for change, to have hard conversations and be present, others will continue to take the decision knowingly or unknowingly about the things that they think are the best things for us. Unless we go and say, well, I think otherwise. Let's work all together. And that's one of the beautiful things about heart. It teaches us how to connect with people to make change. Unless we are ready for that treatment. And most importantly, after the treatment, making sure that we create prevention to make sure that our communities are represented, we will actually not fix absolutely anything that we have around us.
That's right. That's completely right. Thank you for that final message. Now, before we finish our conversation, we have these last 3 minutes of some rapid fire questions. And
Ready.
I can see that you're excited about those. Okay, so here we go. First question. What book could you recommend people if they want to just pick a really good read and start it?
The Alchemist.
Thank you. Second question. Is there any particular music that you like to listen to?
Reggaeton.
Okay, amazing. Thank you. Question number 3. If you were able to meet with any person from the world's history and have like a cup of coffee, tea, who would that be? Why?
Albert Einstein, because he was part of a lot of history, from his equations to war to a lot of efforts to make sure that everybody was treated the way that they're supposed to. He fought against discrimination. He fought against absolutely everything, various cultures, Soviets, US, Nazis, absolutely everything. Then understanding what was actually his driver to survive and continue to be as sane as he was, that was something that I would love to ask him.
Amazing. And final question. If you were not a physician, what will be your profession?
Are you ready?
Yeah.
Diplomat.
Nice. I would love to see Ambassador Shapiro around the world somewhere. All right. Muchísimas gracias. Muchísimas gracias por esta conversación. Thank you very much for joining us today. It has been a thrill, amazing conversation. So thank you for joining us, and we hope that we will be seeing each other soon.
Thank you for absolutely everything. And please join the movement because we need you out there.
Thank you, everyone. See you next time. Thank you for joining.